So what is physiotherapy and what is functional movement? If you Google either one of those things or go on Instagram, you're going to see a million different guys doing all these crazy exercises, and they're awesome. They're incredibly highly effective. But just on a high level, when we're talking about functional movement or physiotherapy, all we're looking at doing is getting the body moving normally again, helping heal muscle tissue, and making sure the movement pattern that you're training on is a healthy movement pattern. Like just because you work your biceps or just because you work your quads and you get stronger doesn't mean that you've created a healthy movement pattern. I can't tell you how many times I've seen a high level athlete who can have a 30-inch vertical, who can squat over 1,000 pounds, but we have him go from a sitting position to a standing position, they can't even move normal. Or when we try to just have them stand on one leg and just do a simple movement test, their basic movement patterns have faults to them, but their high level stuff is working really well, so they don't think there's a problem. This is where people get set up for multiple injuries. This is where the weekend warrior goes out and gets hurt, or this is where the high level athlete keeps pulling the same hamstring or keeps tearing the same shoulder ligaments. With physiotherapy and functional movement, what we work on here is we do the assessment first to see where the baseline is on your simple movements. Once we know your simple movements, then we can test your high-level movements. And once we test your high-level movements, we can see whether you're either perfectly fine to go back in, or you just need to keep conditioning the body, or do we need to go back into on a more fundamental level and retrain the neuromuscular pattern for those muscles, re-strengthen the pathway to get you moving again normally. This is really what functional movement and physiotherapy is about. So if you've had an injury, or you're not recovering the way that you expected to, or you keep recurring with the same injury, then you may want to work with somebody who does more of this functional movement type of work rather than just PT or personal training. So if you're in that scenario and you want to sit down with one of our doctors, feel free to set up a consultation below, and if you've had any previous medical work, just bring that in with you, but we look forward to meeting you.